Have you ever considered the thrill of owning a business that not only turns a profit, but also makes a real difference in people's lives? Now's your chance with medical staffing. I'm KarL Pierre, and I've navigated the complexities of this industry to build a life where financial growth and global living aren't just dreams, they're my reality. Today, I'm going to show you how strategic financial choices can open doors to such an entrepreneurial adventure. If you're eager to learn how a medical staffing company could be your ticket to a rewarding future and how to start one of these companies for yourself, make sure to like and subscribe for continuous tips on how to do so. Medical staffing is a dynamic engine within the healthcare sector, but what's the mechanism behind it? It's about seamlessly connecting qualified professionals with healthcare facilities in need. From temporary assignments to long-term placements, staffing agencies are the silent heroes in the industry. A lot of people don't think so, but I certainly do think so, because we fill an important gap that exists within the industry when facilities are low staffed. Speaking of the industry, the size of the medical staffing industry, or really the healthcare industry in total within the United States, is $4 trillion. So when you have an industry group that's that large, by placing yourself within that industry, there's a high probability of some of the money flow really landing on you and building out a pretty productive business. That's why a lot of companies, when they're getting started, they look at the market size to see what's the true addressable market. And the bigger the numbers, it shows you that there's a lot of opportunity out there for you. So when you're thinking about the broader healthcare industry, you have hospitals that you could potentially staff, you have nursing homes, skilled nursing facilities and rehabs, you have all the outpatient centers, the medical imaging centers, the ambulatory surgery sites. You could even staff home healthcare agencies. So when you look at the broader kind of market, there's a lot of tranches that you could address. Most people automatically think about placing nurses. It's nursing agencies. A lot of the times that's what they refer to us as. But you're not just a nursing agency. You could staff physicians, you could staff dentists, hygienists, you could staff even the grounds crews that handle the landscaping at facilities. If there's an employee group that works within any of these facilities, you could potentially staff them. Medical assistants, billers and coders, whatever you're familiar with or whatever's in need is where the opportunity exists. Once you've decided which sort of area you might start your business, I think it's also important for you to consider what sort of skills you're going to need to have to be successful in this business. I think the number one skill people must have when getting into medical staffing is the ability to communicate and gain people's trust, because you're going to have to go into facilities and negotiate with facilities that you are the agency that's going to help them meet their staffing needs and also provide them with quality staff that are ultimately going to be taking care of people. You also need to be able to communicate to your workers that you're the agency that's going to help them find the work that they're looking for in an environment that is rewarding so that they get the most out of their skill set and their day-to-day. Outside of this personal skill, you're going to also need to have good organization skills, right? You need to be organized because it's time and attendance, it's maintaining records, it's keeping schedules in order. So if you're a very disorganized person and a very introverted person that doesn't really have good skills, this may not be the industry for you. But if you have really good people skills and you have good day-to-day organizational skills, I think that you could find success in this business. For example, let's look at my own ventures, building staffing firms and starting AidBook, a tech-focused home healthcare service. There are two sides of the same coin, each addressing the urgent need for quality healthcare providers, yet operating under different models to meet the industry's demands. So when you're looking at medical staffing and home healthcare, they're the same in that both of those company types are going to need to hire staff, are going to need to find opportunities for them to work, are going to need to handle their employee records, payroll, all the insurance that's involved with running one of these companies. It's all going to be the same between the two types. The difference is that with medical staffing, you're staffing other providers. So you're really only responsible for the workers. Once they're in the facility is responsible for what happens with the coordination of care and what happens with the patient. In home health care, it's the agency that's responsible for each patient's lives. Now, they're going to vary in a few different ways. First of all, when you're dealing with medical staffing, you're going out there and you're contracting with the provider themselves. When you're doing home healthcare and filling that need, you're actually going out there and either contracting with insurance companies that need your service, or you're going into the community and finding patients or referral sources that will provide you with the patients that you're going to care for. So when it's medical staffing, you're able to land one contract and staff many people. When it's home healthcare, you're typically landing one referral and staffing that individual in their own homes in a bunch of different locations. So when I compare the two, I tend to tell people to start with medical staffing. For example, when it comes to my own story, we started in the nursing agency business. We were staffing long-term care facilities originally, and we realized that there was some opportunity in home healthcare and that there was a lot of overlap. Our experience running a nursing agency allowed us to learn how to recruit nurses, how to run payroll, how to manage a team, how to grow that business out. And then we realized that we could apply the same sort of human resource functions and the same administrative functions, and that would be kind of like 50% or so of the battle of running a home care agency. So we decided to add that home care piece. So when I'm consulting and meeting with people about the two, because a lot of times they ask me since I'm in both lines of business, I tend to tell them that start with medical staffing so you could get your footing. And then when you decide that you want to be responsible for patients' lives and you want to have that exposure in home healthcare, then go into home healthcare. Because to start with home healthcare can be difficult because you're going to be handling the patient and you're going to be handling all the administrative work at the same time. Now, if you're ready to really embark on your own entrepreneur journey in medical staffing, I'm here to guide you. Here are the steps that I think that you should take to get started. First of all, one thing that everybody seems to neglect, whether you look online or you look at guidebooks, is you really are a connector of facilities with people. And a lot of people, when they get started in this business, they worry about all of the appearances, all of the things that make them look official before ever going out there and talking to people. I think the very first thing that anybody who's getting into the medical staffing business should do is they should go out there and start talking to the people in the facilities and the areas that they think that they're going to be staffing. The reason for this is because landing the contracts is where most people stall out, and you want to be able to get valuable feedback. For example, if you go into a facility and you plan on staffing nurses, but that facility turned around and told you, we're actually good on nurses. We don't like to work with agencies for nurses, but we're short on surgical techs. Our OR is always in need. We have to shut down some of our rooms. If you get me surgical techs and sterile techs that could keep our OR up, I'll contract with you. And that might put you in a whole new direction for who you should be targeting as far as employees. And you might find out after talking to 5 hospitals that they all need surgical techs. Meanwhile, your initial thought was, I'm going to staff nurses. So having those conversations can point you in the right direction of where you need to go. Also, a lot of people who are starting this business are usually in the healthcare space already. So it helps to go to your own facility to talk about your ideas. Usually those people already trust you a bit and they give you the time of day. When you're coming in cold and you're just a voice on the phone, people don't want to be sold in that way. But if you have a working relationship with the director of your department and you could say, hey, I've been thinking about starting a staffing agency because we're so short-staffed here, they're going to at least give you the time of day to give you feedback and potentially offer you your first deal. So it's important that the very first thing that you do if you're going to start this business is start having conversations. Also talk to your colleagues. Your colleagues may tell you what sort of facilities they're interested in, what are their pay expectations. They'll tell you, if you can get me this job, I'll work 20 hours a week for you because I really want to get exposure to the OR and I'm tired of working med-surg. So by having those conversations, it's going to really help you pick your niche. Obviously, the default is to start with what you think you know, but when you start talking to people, you might realize that there's a need somewhere else. And lastly, you're going to need to get the tools that are going to help you succeed, whether it's the software or the knowledge and the education to really do things the right way. Aside from that, there's of course the basics, right? You're going to have to set up a company, you're going to have to get the necessary insurance, you're going to have to get payroll, set up your website, you're going to have to create an employee manual, you're going to have to get a contract because you might need to actually forward contracts to providers because not all of them have their own contract. Usually bigger systems do, But the smaller guys, they're counting on your contract. These are the basics that you're going to need to do, but the real meat and potatoes of the business are connecting those two groups, the providers and the workers. And you really need to kind of prioritize that while you're getting started. So if the idea of starting your own medical staffing agency sparks your interest, visit my consulting company website, passiveworkforce.com, for our expert guidance. There, we're able to do everything for you, actually. We have online courses, we have mentoring, and we also have a full service setup where we do all of the steps, like picking your company colors, helping you kind of come up with your mission, vision, core values, really setting up your brand, your website, all of the licensing, all of the policy and procedures. Everything that needs to be done administratively will help you. And then we give you guidance on how you could go out there and get contracts, how to run your business with the right operational models and processes. So we really handhold you the entire way to make sure that you launch properly. And when you've launched and you're ready to optimize your business operations, you can check out our software at ontimeits.com because it really is the right tool to help you run one of these businesses with greater efficiency. I'll be covering a lot of the behind the scenes and education right here on my channel, as well as on my other channel, Passive Workforce, which is dedicated to healthcare entrepreneurship. If you find this to be really exciting, check out this video right here for even more information to take you to the next level.